How do you like your testosterone? Finding the best TRT approach in ABQ for you is essential, and that's exactly what we're here to help you with. Testosterone Replacement Therapy, or TRT, has become a vital option for those looking to address low testosterone levels and the associated health concerns. But among the various decisions you'll face when considering TRT, choosing the right administration method is paramount. In this article, we'll delve into the three primary TRT approaches: injections, gels, and patches. We'll provide insights into their benefits, considerations, and important factors that will enable you to make an informed decision tailored specifically to your needs. Let's start with injections. These are one of the most common TRT methods. Administered by a healthcare professional, injections deliver a rapid and controlled release of testosterone into your bloodstream. This approach ensures consistent levels of testosterone, often requiring less frequent dosing compared to other methods. The advantages are clear: quick onset of action for rapid symptom relief, precise dosage adjustment to tailor the procedure to your unique requirements, and minimized risk of unintentional transfer to others. However, consider the potential discomfort or pain at the injection site, the need for regular clinic visits, and possible fluctuations in testosterone levels as the dosing cycle progresses. Now, let's talk about gels. These are applied topically to the skin and are absorbed gradually, releasing testosterone into your bloodstream. Gels offer the convenience of easy application and a steady release of testosterone, with no need for injections or constant medical supervision. They also come with a lower risk of skin irritation, but be aware of the risk of accidental transfer to others if the gel isn't fully absorbed and absorption variability based on factors like skin condition. Achieving the optimal dosage may require adjustments over time, necessitating close collaboration with healthcare providers. Finally, there are patches, which are applied to the skin and release testosterone through it. These patches provide consistent and steady testosterone release, minimizing the risk of transfer to others. They're user-friendly, discreet, and don't require frequent interventions like injections or daily gel application. However, be cautious about possible skin irritation or allergic reactions at the application site, and remember to rotate where you apply the patches to prevent localized irritation. In conclusion, the choice between injections, gels, or patches depends on various factors, including your lifestyle, preferences, medical history, and potential side effects. Consulting a medical professional experienced in TRT is crucial to make an informed decision. They can guide you through the benefits and considerations of each method, taking into account your individual needs.